Heartburn. Almost everyone has experienced it at some point. That burning sensation creeping up in your chest after a big meal. Maybe you grab an antacid, the pain disappears, and you forget about it. But what if I told you that frequent heartburn isn't just annoying? It can permanently damage your esophagus, cause chronic cough, destroy your sleep, erode your teeth, and in some cases, even increase your risk of esophageal cancer. I'm PA Eric, a physician assistant with 10 years of clinical experience, and today we're going to talk about GERD. What it is, why it happens, how to recognize it, and most importantly, what you can do about it before it causes long-term damage. Let's dive in. It's the channel dedicated to health, fitness, longevity, and aquatic adventures for folks over 40. Welcome back to Motion Over Medicine with your host, PA Eric. So, what is GERD? GERD stands for gastroesophageal reflux disease. Let's break that down. The esophagus is the tube that carries food from your mouth down to your stomach. At the bottom of that tube is a muscular valve called the lower esophageal sphincter, or LES. Think of it like a one-way door. Food goes down, the door closes, and stomach contents stay where they belong. The problem starts when that valve becomes weak or relaxes when it shouldn't. Instead of keeping stomach acid in the stomach, acid splashes backwards into the esophagus. That process is called acid reflux. Everyone has a little reflux once in a while. GERD is different. GERD means reflux happens frequently enough that it causes symptoms or begins damaging the esophagus. Why does acid cause so much trouble? Your stomach is designed to handle acid. It has a thick protective lining of mucus. Your esophagus doesn't. So every time acid repeatedly washes over the esophagus, it causes irritation and inflammation. Imagine pouring lemon juice on a paper cut over and over again. Eventually, that tissue becomes inflamed, then swollen, then scarred. The same thing can happen inside your esophagus. So, what are common symptoms? The classic symptom is heartburn. That's the burning sensation behind the breastbone that often gets worse after eating or when lying down. Many people also notice acid or sour liquid coming into the mouth, regurgitation of food, chest discomfort, difficulty swallowing, feeling like food gets stuck, burping, nausea after meals, and a bitter taste in the mouth. But GERD doesn't always look like heartburn. Some patients never experience heartburn at all. Instead, they develop a chronic cough, frequent throat clearing, hoarseness, a lump in the throat sensation, sore throat, asthma that's difficult to control, or bad breath. These symptoms occur because tiny amounts of acid can reach the throat, the voice box, and sometimes even the airways. So, what causes GERD? Several things increase your risk. Being overweight is one of the biggest. Extra abdominal pressure literally pushes stomach contents upwards. Large meals stretch the stomach and increase reflux. Lying down too soon after eating removes the positive effects of gravity, making reflux much worse. Certain foods relax the lower esophageal sphincter, including fatty foods, fried foods, chocolate, peppermint, and alcohol. Others may irritate symptoms even more, such as coffee, citrus fruits, tomato products, carbonated beverages, and spicy foods. Not everyone has the same triggers. Keeping a food diary can help identify yours. Smoking also weakens the lower esophageal sphincter. Pregnancy commonly causes reflux because of hormonal changes and increased abdominal pressure. Certain medications can also contribute. What happens if you ignore it? Occasional heartburn usually isn't dangerous. Untreated GERD is different. Over time, chronic acid exposure can produce ulcers inside the esophagus. Healing could lead to scar tissue. Scar tissue can narrow the esophagus, making swallowing progressively more difficult. Some people begin avoiding certain foods because they feel like they're getting stuck. Another concern is something called Barrett's esophagus. This occurs when repeated acid exposure causes the cells lining the lower esophagus to change into a different type of cell that's more resistant to acid. While Barrett's itself isn't cancer, it does increase the risk of developing esophageal adenocarcinoma. The overall risk is still relatively low, but it's one reason persistent reflux shouldn't simply be ignored for years. So, how is GERD diagnosed? Often, the diagnosis is made based on symptoms. If someone has classic heartburn that improves with treatment, that's usually enough to begin therapy. However, certain warning signs deserve prompt medical evaluation. These include difficulty swallowing, painful swallowing, vomiting blood, black stools, unexplained weight loss, persistent vomiting, or symptoms beginning later in life that rapidly worsen. Sometimes an upper endoscopy is recommended. This allows a gastroenterologist to directly examine the esophagus for inflammation, ulcers, Barrett's esophagus, or other problems. In certain cases, specialized testing can actually measure acid exposure inside the esophagus over 24 hours. In the urgent care and emergency room, it's not uncommon for people to present with chest pain, which the patient can often confuse for symptoms of a heart attack. A little trick I learned in PA school that works great, but for some reason isn't always used in these acute care facilities: a GI cocktail. This is a mixture of a few mils of viscous lidocaine and an antacid. Sometimes benzyl might be added, which is an antispasmodic. If we give this to a patient and the chest pain almost instantly resolves, we're nearly certain it's just GERD. If your provider doesn't offer this, don't be afraid to ask for it. The main ingredient here is the viscous lidocaine, which numbs the esophagus as it's ingested and temporarily relieves all pain. It's effective, but tastes terrible and will numb your entire tongue and mouth. So be prepared. The good news about overcoming GERD: lifestyle changes work. This is where many people have tremendous success. If you're overweight, losing even 5 to 10% of your body weight can significantly improve a reflux. Avoid eating large meals late in the evening. Try to finish dinner at least 3 hours before bedtime. If nighttime reflux is your biggest problem, elevating the head of your bed can help gravity keep acid where it belongs. Simply adding extra pillows usually isn't enough because it bends your body instead of lifting your upper torso. One trick that was taught in PA school was having a 4x4 piece of lumber cut to the width of your bed and inserting it between the box spring and mattress towards the head of the bed to create a mild incline. If anybody tries this, please comment below on whether or not this was effective for you. Learn your trigger foods. You don't necessarily have to eliminate everything on the list forever. Find out what actually causes your symptoms. Quit smoking if you smoke, limit alcohol if it's a trigger, and remember that smaller meals are often much easier on reflux than one giant dinner. If lifestyle changes aren't quite enough, medications can be very effective. The quickest relief often comes from antacids like calcium carbonate. These can instantly neutralize existing stomach acid, but they don't last very long. Another group includes H2 blockers, which reduce acid production for several hours. Examples include famotidine. You might be familiar with the trade name Pepcid. The strongest acid suppressors are proton pump inhibitors, or PPIs. I've been amazed by the wide range of stomach pains I've been able to treat with PPIs, but keep in mind these are often just masking the problem. Examples include omeprazole, pantoprazole, and lansoprazole. These medications dramatically reduce stomach acid production and are often the most effective treatment for healing inflammation. Originally, PPIs were only available by prescription, but they're now readily available over the counter. I like omeprazole, as it very infrequently lets my patients down. Take 20 milligrams prior to breakfast and follow up with your primary care provider to determine if ongoing treatment is necessary. Like any medication, PPIs have potential risks, particularly when used long-term without a good reason. Sometimes surgery is needed, although not often in my experience. If medications don't control symptoms or if someone wants to avoid lifelong medication, surgery may be an option. The most common procedure strengthens the valve between the stomach and esophagus, helping prevent reflux from occurring in the first place. For carefully selected patients, it can provide excellent long-term relief. GERD isn't just heartburn. It's a disease that can quietly damage your esophagus for years before serious complications can develop. The encouraging news is that many people can dramatically improve or even eliminate their symptoms with weight loss, healthier eating habits, avoiding late-night meals, and identifying their personal triggers. Medications are excellent tools when they're needed, but they're most effective when combined with lifestyle changes rather than replacing them. If you're having reflux more than a couple times a week, or you're developing trouble swallowing, chronic cough, or symptoms that just won't go away, don't ignore it. If your esophagus is telling you something, take care of it now, and it may save you years of discomfort, and potentially much more serious problems down the road. I'm PA Eric, and I help folks over 40 stay healthy, active, and independent as long as possible using fitness, nutrition, and practical medical knowledge. My channel is Motion Over Medicine, because the best prescription often begins with the choices you make every day. If today's content was helpful, make sure to subscribe, like, and share this video with someone you think might benefit from it. See you in the next video.